So module 2 was the language of pain, seeking expression amidst the chaos. A lot of this stuff kind of, like, I think we'll have similar conversations to what we did last week because there's a lot of overlap. But I think given how much we were able to talk about it last week, it'd be interesting to get everyone's thoughts, especially because there's a bit more interesting stuff this week. So this first one, communication is a three-way street. So I guess if we look at this picture first, we've got skills at the top. Skills include informing, asking, and listening. And then our style can be directing, guiding, or following. And basically, like, they did a whole study on this, but basically they were saying that there's not a right or wrong style or right or wrong way of communicating. It's more about knowing when to pick and choose different types of skills or different ways of communicating. So if we come down here, then we look, you know, it's not as simple as open questions are good and closed questions are bad. And I think we did briefly touch on that last week, but just I would be interested to hear people's thoughts on, I guess, when they think open-ended questions would be more valuable versus then when more closed questions would be more appropriate. So let's start with Ives.
Yeah, I hate when they start with me. Now I know what it's like. Do you guys know what open and closed-ended questions are like? So yeah, that's a really good question. I really like open-ended questions in general, so I'll say that. But I think when you're building rapport, it's certainly important to engage in people and to have open-ended questions. And when you're, I guess it's not showing more authority, but maybe trying to get people to buy into something and showing them way, that's sort of when I use closed a little bit more. But it's never as simple as that, as the quote says. But that's just my initial thoughts. Building rapport, it's really good to ask those open-ended questions to keep people engaged. And closed when you're being a bit more authoritative and trying to guide people in the direction you want them to go.
Yeah, definitely agree. Jack?
Yeah, I think, like, as a general sort of a rule, just to start with open-ended, and then depending how you're feeling the situation is going or how they're responding, sort of move towards, you know, along the continuum of closed or something like that. But I think starting with open is a good general rule.
Definitely agree with that. Riley, what do you reckon? And I guess this doesn't even need to be in like a physio specific context. Like, even when we think back to the communication stuff that we did with Darren, like, what are your thoughts on like open-ended versus closed questions?
Yeah, kind of similar to what everyone said. I feel like open questions are good when you're trying to like have a connection with someone or like build a relationship with someone and kind of make them feel a bit more comfortable, I guess. And then like closed questions, I mean, I don't know, like I feel like they can be good when you're just trying to get to the, like, there's only so much you can say in some situations, and like there's only so much that needs to be said as well. So I feel like closed questions aren't always a bad thing. They just get to the point quicker.
Definitely. And Rose, anything else bad?
Yeah, I just agree with Riley. I feel like closed questions kind of like you're trying to like sort an answer, like a direct answer. It's like quicker and stuff, but probably best to start off with open questions when you're building that relationship.
Absolutely. And I think like even coming down to individual patient like personalities and stuff, like some people, you know, you can give them an open question and they'll just like tell you everything, and that's sweet, whereas other people you really have to like start to pry out that information more. And so more closed questions can almost make them feel more comfortable to just, or like make it easy for them to just answer. Like, I guess that's where this quote comes in, like not everyone's going to react the same to the same kinds of questions. So being able to, I guess, like ebb and flow between those two kinds of things can be really useful when you're doing a subjective examination or just communicating in general. I thought this quote was really interesting. So it says, like guides, this was a teacher who said this, but like guides, we walk at times ahead of our students. And if we replace that with clients in our context, times we walk ahead of our clients, at times beside them, and at times we follow their lead, and sensing where to walk lies our art. So I thought that was really cool, because I think, again, it just shows like where it's not a case of like we're in charge, we're the authority, and we're like telling them what to do. Sometimes, yes, you'll need to like take the front foot and kind of guide them through, but also sometimes it's going to be the opposite, and you're going to need to like roll with their punches, and sometimes you're going to need to work, well, ideally always, but sometimes you're going to need to do these things together. So I thought that was an interesting quote, but again, I'd be interested to hear what you guys thought about that, if anyone had anything else to say.
I just love it. I think it's because, like you said, I think sometimes, like you said, we all have our defaults, right? And Jacinta and Jack particularly, you can probably find that sometimes we might, walk beside our clients more, but sometimes we do need to follow the lead, or other times we need to give them more direction. And I just love that concept, because it's not as easy as just, we are so a clinic that it invested so much in this stuff, but sometimes we do need to walk ahead or behind them. And I think that's really nice. It's not as just simple as, what is good communication. It's communication at the right time, I think, as well. Can you think of any examples where you've transitioned your communication between a client?
I like that, like the that analogy we were using, that the patient is the star, like you're just the piano player sort of in the background, whereas they're the lead singer, and you've got to, I guess, be malleable to them and their personality and their communication style. So this is, I guess, similar to that, in the sense that you're just going to be like malleable to their up, that up or down thing as well. They
If you use that analogy, Jack, with the piano player, and Rose, you weren't there for that, but Darren essentially alluded to the fact that our relationship with our clients should be like the piano player supporting a singer, and saying that we're not there to overtake them, we're there to support them, give them the best support so they can perform. And that could be on a big stage in front of a big audience, but using Jack's analogy, that could be literally, in practice, where they're just not hitting the right notes, and helping them do that. It can be comforting them if they're feeling a bit not happy with where they're at. It's very different at different times, isn't it? Really like that analogy. Actually, works well here.
And I think as well, it's appropriate for like say if you've got a patient who maybe needs a bit more of a push, then that could be a situation where, maybe you're walking ahead and you're like leading them and showing them the way, and then other patients are really like, into it, and that's when you're gonna either walk, follow their lead and roll with the punches, or you're gonna walk through that together. So I thought that's interesting. Girls, do you have anything else to add with that?
Not really, just what everyone else has said.
I really like it. I feel like a lot of people though wouldn't think this. So
in
like it's
just
really
a physio context, or just life in
general?
Yeah.
Like in a physio context, like they wouldn't like see the value of like, they'd be like, no, like I don't follow them. I don't know, maybe that's me, like naive, but I feel like some people wouldn't think like that. So like it's good.
Do you think that could almost be related to like last week when we were talking about, I guess, a similar thing where it's like shared decision making, or if we ask the patient like, what do you think is going to make you better, or what do you want to do, like that has its pros, but then you guys were also saying like sometimes you're just coming to, like, yes, you want to be given the choice, but also sometimes you're coming professional because you want them to make the decision. Do you think that's like a similar thing?
Yeah, that's exactly it. Yeah, that's exactly it. Yeah, it's probably just not like understanding a physio's role in a way, like how they can support in like many different ways. But I really like it. Good little phrase, quote.
That's good. All right, let's unpack this. These are just little reminders to myself because I always forget what I want to talk about. This was another quote: pain erects a wall between us and the outside world. At the same time, it prevents us from breaching that wall by communicating the experience to others. So I guess points that the speaker made here was that empathy is about making the invisible visible, and that we really want to focus on developing communication skills that may help to start breaking the wall down. So if we start with the physios, like what's your perspective on that statement, given, I guess, like the experience that you've seen with people's pain experience and how they communicate and live that? Maybe we start with eyes. I feel like you've seen more.
I just think it's so important. I just been thinking about a lovely new client who I just saw yesterday, and just all those wonderful tips and tricks we talked about building empathy and rapport really helped him understand that, I genuinely care about where he's at and what I want to do to help him get back to his goals, and not just, and it was really nice yesterday because I was even able to pre-frame, all right, once we get out of pain, we're going to work on this. And it was really nice. And I know that you need to build that rapport through effective communication at the start, so the client can really help understand that, I actually do, these people do care about me and where I want to head. And I think it was a really nice final session I had yesterday. And I thought to myself, that's awesome, because I could tell straight away this is going to be an ideal client who fits in well with YSP. And then he just started sharing, which was really interesting, and talked about his whole life journey from coming out as a 12-year-old to his new town. I was like, wow, that's very interesting. Once you build that rapport, how people just feel open and talk about themselves in a beautiful way, which I think is great. And then obviously we can connect it back to why they're there really effectively. But I think that's nice. I think too early in my career, I was so focused on pain and not building these connections. And I was frustrated when people, dropped off and I stopped seeing them. And a big part of it was just showing that you care. So sorry, that was a bit long-winded, but I hope I made my point there.
Yeah, that was good. I feel like, that's why I do like that we all tend to ask, like, just like, what brings you in today, or how's everything going, rather than focusing on the pain. Because for these people, like, they are likely to be so focused on the pain, so it can almost be refreshing to not have that. It's not that it's not the focus, but like, we care about more than just that, and by showing that we care, it actually unlocks a lot more information. Because I guess, like, what that statement says to me is, like, when you're in pain, sometimes you can feel like quite isolated, or just like separate from the world, and that then puts up that wall. And if you can't communicate how you're feeling and what your pain does feel like, it can prevent you from communicating that experience to others. So it's all about, how can we help people communicate that? The guy did a whole thing about getting people to draw their pain. I didn't include that because for me, that's a bit woo-woo, so I didn't really want to talk about that, especially with like our client population, but still an interesting concept. Jack, do you have anything to add?
Yeah, I was just going to go off what I've said. With pain, there often can be that wall to, having to bring that wall down to be able to connect them. But there's also like a huge opportunity to connect with them once that wall comes down, maybe more so than if there wasn't a wall to begin with. So that's sort of similar to what I was sort of saying with his patient yesterday. And even I had a new one today, and she, had a lot going on, I guess. And I think there was a wall to begin with, especially she came in and there's like, Antonia, Joe, Chris, Mario, all like greeting her. And then I'm like, no, like, my patient, just like get away from them, just come in here, sort of thing. And there's a bit going on at the start, but I think I was able to just like, because she had like a long history, it was kind of, I just wanted to repeat a lot of what she said to just show that I was listening and not sort of forgetting about some stuff. And I saw something like that recently, so I was just making an effort just to repeat a lot of what she was saying. And I think that's listening is a big part of this.
Girls, do you have anything to add either, well, about anything, but I guess in particular either from your experience sitting in with us or even your own experience going to any like healthcare professional?
Not really, just kind of what everyone said, and like you're just going to get more out of someone who is like empathetic and like actually listens than if, you know, they weren't like that, if that makes sense. Everyone else explained it so well, so yeah.
Yeah,
Yeah,
I feel
I
like
don't really.
oh, you go Rose first.
Sorry. Yeah, I agree with all you guys. I don't know. I feel like you guys like just do it like so like subconsciously. Like you don't even like it's like just comes like almost naturally, obviously, because you've just had so much experience. But like that's the way you kind of want to. You don't want to like be like overly empathetic as well, so it like looks fake. So I think you guys have like a good balance as well. If you get me.
I think the thing that like, yeah, definitely agree. I think the thing that at least for me solidified it the most was being on a hospital placement, and I guess the difference between saying like let's say like the total hip replacement patient versus the patient who has a total hip replacement, like there's more to that person than their condition or like what they're presenting with. And that for me, I guess like aligns with this quote. Like there's more to that person than whatever pain they're experiencing. And yeah, that might help them feel more seen if you can recognize that. So then they talked a lot about metaphors. I think we also touched on metaphors last week, but so last week we were saying how patient-generated metaphors can be a really good way of understanding like how they're feeling and what's going on, but also helping to change or adjust their maybe like misconceptions or beliefs about things. And in this module, he was just talking about how metaphors can either break down or build up communication barriers. So it kind of comes down to, again, what we were saying last week, you know, metaphors can be great if you're on the same page, but we also don't want to leave things open for interpretation. I think the wording was like ambiguous or like misinterpretation of ambiguous stimuli. Do you guys remember that? Honestly, I don't know what this slide is, to be honest, but I think he was just trying to give examples of like different kinds of metaphors and where maybe they could have some merit, where maybe they're less of a good thing. So journeys, you know, that has like quite a positive connotation. It's kind of helps with like reframing, like, you know, I'm on this journey, it's going to take time, it's not going to happen overnight, but we're going to get there, and there's a lot of in a tunnel. Patient generated and culturally relevant is obviously super important. I thought battlefields is interesting, like seeing pain as something we fight, because I kind of like half agree and half disagree with that statement. Does anyone have an opinion on seeing pain as something that we fight, whether they agree with it or not?
Is it something? It depends, isn't it?
I was gonna say, Ives, you look like you have something to say.
It's such a bad analogy, isn't it? I don't know. Pain,
Yeah.
relationship with pain is really what's got to change. I mean, I know how easy it is to fall back into old habits with this, but pain is telling us something, and I think to say it's something, but it then gives people that false sense that, all right, as soon as we fight the pain and the pain goes away, we're done. And we know most of the time we're not done. Because there's a reason why you're in pain in the first place, and it's simply going to come back. So I just can't agree. And just the analogy of fighting it, I think, will screw with people's minds. So yeah, I'm not a fan.
Yeah, definitely. Definitely.
But some people might, I don't know. Some people might like it, but yeah, I don't know.
Yeah, I probably wouldn't be using it for the vast majority.
No.
Some people use
the only thing I like about it is like you want to do something about the pain, but it's really not. It's a lot more than that. Sorry, Rose, you go.
Sorry, just some people or maybe like I've been told it before. Like they use the analogy of like a mountain. Like even that's like okay. But like it still kind of has like it's gonna be like setbacks and like exhausting, like that's what I envision. So like I don't know. Yeah, I agree. You have to be like so careful.
Yeah, I
And,
feel
like,
like I
some
like
might
being
work
positive
for-
about it all. But that's just a personal thing.
Yeah. And like some might work for some people, but then other people will have like negative connotations to it. So I don't know.
Yeah, we all interpret things differently. So they actually did a study on this, which I find interesting in itself. So do metaphors have therapeutic value for people in pain? So if we come down to beneficial factors and detrimental factors on each side, starting with self-control. So obviously beneficial things with using metaphors, we can gain empowerment, resilience, and self-efficacy by establishing a mutual understanding, connection, and it's also really good for allowing patients to express their pain or express their experience in a way that's relevant for them. But on the other side of it, you know, almost the complete opposite, we can have disempowerment, disability, or depression. So again, linking back to that misinterpretation conversation from last week, it can lead to confusion, isolation, or even simplification. I found it interesting that they didn't, I guess, come to a conclusion on this study. Like we talked about it a lot more in the course, but I guess based on what we talked about last week and then what we talked about on the previous slide, what do you all take from that diagram, if anything at all? Like I said, today's is a bit more not necessarily agreeing with everything, but just using it as a good talking point.
Yeah, I think just understanding when you do start using metaphors that there is, I guess, some risk with it, that a patient can take it the wrong way, different to what you're trying to interpret it as or trying to explain it as. So, it's just like we don't use a cookie cutter recipe approach to each rehab. Try to do the same with a lot of these metaphors and analogies. And maybe just check with the patient's understanding after that as well.
Yeah, in that regard, just like just how people, when we spoke about last week, 75% of what you say people will forget, and 50% of what they remember they'll misinterpret. So it's really important if you have a few key issues just to make sure you repeat yourself and be very clear about it. And we all know how empowering words can be, but at the same time, there's no doubt we see people who have been to others who have just, those horrible phrases, bone on bone. I did a presentation actually yesterday did a swap for Tanya, so I did it for my sister's 15 of her PhD students, and it's so interesting some of the words they used about their pain. I was like, wow, look at all these flags coming at me. Just like,
we're going to get into that in the next slide, don't worry.
Crazy. So anyway, just to summarize it, just remembering how important it is to make clear that they understand what you're saying. I think that's really important.
So last week we talked about, I guess, like misunderstandings, and I gave the example of the pelvic floor. So Jack, I don't think you were on for this part, but basically we were talking about how we want to make sure that we're trying not to communicate anything in an ambiguous manner that then leaves itself open for a misinterpretation. And the example I gave was basically this patient had been told by her doctor or specialist or something that her pelvic floor had like collapsed or it had collapsed, so they were recommending physiotherapy for that. And she was saying like, no, like how is physiotherapy going to help? Like literally my floor has collapsed and it's like gone. Like how's physio going to help? Like she literally thought that was like a floor and walls, like literally, which we thought was funny, but like it does kind of make sense if you had no,
fair enough, yeah.
if you didn't have that level of health literacy, like you might, yeah, read into that a bit more and then be like, well, yeah, like how's physio going to help? Or like people who have like rotator cuff tears, they're like, well, it's torn, like how's physio going to help? The other one was like arthritis is bone on bone, and they're like, well, I can't move because like it's literally my bone on my bone, like it's going to grind and like wear away at each other. So there were some examples we talked about, but I thought the rest of these were interesting. Crumbling spine, I've not heard anyone say that, but my spine's like a cheesecake base. Whiplash punishment, that's a bit random. The intervertebral discs being like a jammed donut. One particular patient, like an example that was given, this person thought that jammed donut then correlated to like, well, jam is red and that means blood, so I'm like internally bleeding, like I've got a hemorrhage, like my disc is hemorrhaged in my back. Pain gate, just close the gate, it's easy. And frozen shoulder, just thaw it out, it can't be that hard.
Like an
So
back on it.
yeah. What are people's thoughts on these? I'm interested.
Like they're all fair enough. Like, you know, we take for granted our health literacy to a degree, I think. You know, there's a lot of terms in, I don't know, business, I don't know, careers that we wouldn't have the idea about. So, you know, it's crazy for us to think that people have no idea what's going on in their bodies, because you know, everyone has a body and they live in it 24/7. But when you see these examples, it's fair enough, and you can easily see how things are misinterpreted and problems arise.
Are you sure you went on this part last week? Because I talked about like if I went to like an accountant and they were talking about like tax stuff, I'd have no idea. And okay, that's just same lines. Anyone else?
No, I don't need to add too much more other than it's just so interesting, and it just reminds you how little things can become big things too. So I love that pain gate. Close the gate. Simple.
Just turn it off.
My spine's like a cheesecake base. I wouldn't mind some cheesecake.
I mean, crumbling spine is an interesting thought of someone anyways.
Jeez. I don't think I'm ever going to get into pain gates with anyone.
Yeah,
yeah, neither. Hey, not worth it.
Not worth it.
No. But yeah, I think it was interesting. And obviously, like, we don't want to be overly cautious because that's just going to come off as inauthentic. But I do think it shows the merit of like still being like choosing our words carefully sometimes, because something that might be a really obvious metaphor for us could like mean something completely different. Like this disc equals jam donut equals internal hemorrhage. Like that's wild. But for this person, that was like the immediate connection, which I just think is fascinating.
I feel like people explain things like the best that work best like because of their experiences. Like even when I explain some things, like say something I'm not very exposed to in an area, like you listen back to yourself and you're like, what were they even saying? Because like they just don't know how to explain it. They just have no awareness of like the concept. So it's so weird. Like I don't even like I don't know, I haven't studied pain yet. So this is like my first yeah. I like jam donut. That's so funny.
Yeah, that was a really funny one.
No, that's great. Cool.
the language of agency. So if we look, I believe what he's trying to demonstrate here is like what would be like a normal process. So you've got an agent, which is like something happening, causing injury and pain. And typically we have one of two responses. So response A is to like withdraw. So like moving away from the thing, or, you know, I hurt my back when I bent over to pick up this thing, so I'm not going to bend over and lift up anything anymore. I hurt my shoulder when I was like reaching behind me in the car, so I just don't do that anymore, that kind of thing. And response 2 is to turn and fight. So almost if we look at like fight or flight response, so this is our flight and this is our fight response. This metaphor is almost trying to unpack what, when we say pain, what does that actually mean? Does pain mean damage? And I think we're all on the same page with that, but we can discuss it anyways, especially if this is being recorded. But yeah, let's start with that. Does pain equal damage? What do we think?
Nope.
No.
Definitely not.
Pain is
Go,
multi-dimensional,
Jack.
and
Yeah,
He's
just tell it
ready.
how it is.
I guess is as a result of a whole lot more different factors, rather as opposed to just solely physical structure or damage. Yeah.
Yeah, I agree. Is there anything to add?
No, just for that one, yeah, couldn't agree more. And we just got to keep changing that narrative. I think that's really important. And just working with the clients that you'll see to just encourage them to build a new relationship with pain. I think it's really, really cool. There's a great, I'm just reminded, as you guys know, what Survivor, and the girl who won is a physio who's studying pain. And she talks about how she did the pain challenge where she held herself in a position like this for 10 hours. And all the crazy stuff, she tricked her brain to thinking this was crazy. It was really interesting when she delved into how she was able to do that. And it's the relationship with pain is what's most important. You know, I love that picture, of course, as well.
So what words or like phrases could we use instead? I know we all like to say, yeah, like what brings you in today, or how's the body feeling? Other things I like to say is more just like talk about their symptoms. So it's not so much focused on pain, because sometimes they say it's not pain, it's something else. Any other, like if we were to brainstorm things that we could say to reframe instead of just focusing on pain, any ideas?
Discomfort.
Yeah, I was going to say that too.
Feeling.
I think I use stress and irritation a lot, but again, they could probably come with some negative connotations as well, maybe less than pain, but I use them a bit.
One thing that I think is interesting is a lot of people they'll say it's not painful, it's just a bit sore, like as if pain is like the extreme and soreness is just like,
yeah.
Like, I don't even know, like I've been wanting to ask what's the difference to you between like sore and painful, but I'm just figuring out how to ask that without coming off a bit wrong.
Yeah, pain and sore.
Yeah, I find that so interesting.
Is an annoying one sometimes, because does that hurt? No, but it's just a bit sore. I think sore is like I can cope with it. Pain, I need to do something about this.
Yeah.
And I feel like people relate
almost seems like
with. Sorry.
No, you go, Rose.
I feel like people relate sore with muscle pain as well, more so than like something else. Because I don't know, I'm sore from the gym, like that kind of thing.
Sore,
Yeah,
you
I agree.
control over. Pain, you don't really have control over, and you might not know what's causing it as well.
Yeah, maybe it's that.
it also seems to be like sore is like more like that dull, achy type feeling, and pain is like that sharp, like more like severe. Yeah, it's definitely interesting. It's definitely interesting.
Yeah.
So even like when we were talking about last week, like when people say nerve pain, like what do they actually mean? What do they mean by that? I would love to know. Last one. So experiential learning and physical metaphors. Bit of a weird title, but basically saying when we're talking with our patients and when we're, you know, communicating about what's going on and our recommendations, there's two potential approaches. So the first one's just stop it. Like don't do that. You shouldn't be doing that. Do this, don't do that. It's very I guess what's the word? Not militant, but just like almost parental, like you're being told what to do and what not to do. And that's how it is. And there's no leeway room. It's also very judgmental, and it disengages the patient by, just telling them what to do rather than involving them in the process. The other way they suggest it is saying, you know, okay, could we try something? Could we try this? Could we try doing that? That really emphasizes that they're in control, and also that it's them, I guess, figuring out the solution and them working on the problem. You're just there to support them and aid them in that process. What do we think about those two? Because I know if someone just told me to stop doing something, someone told me to do something, I'm going to not do it. And if they tell me not to do it, I'm going to do it. I'm very stubborn. And I would feel a lot more open to collaborating if I felt like we were in this together and I wasn't just being bossed around. But what do you all think about those two approaches? And is there an in-between?
Yeah, I like, you know, I like that. It's almost that like permission to try something. I think those, you know, soft permissions and small yeses is a really good way just to engage the client and bring them in and into the decision making. And even with like stop it, I'm assuming stop as in like stop doing a movement. Say back is sore, stop bending over. Like even then, like I really try not to, if in that situation, you know, try not to limit the patient as well, even though like if someone's asking me, or you know, that sort of that example, should I stop bending over? I always, you know, even if it is hurting, no, I think let's keep going and trying to get them in that control of finding that it's okay to bend over, as an example. But yeah, I really do like, you know, that. Why don't you try doing this, or why don't we
Yeah, and I like that it's a suggestion rather than a you must do this.
Yeah,
because I'm the physio and I know what's right.
And the stop it kind of puts fear in their head too. Like if you tell them stop bending over while you're injured, like they probably will struggle to ever bend over without being fearful again. Like, if that makes sense.
Yeah.
That's been my gripe with GPs this year. Like, I don't have much experience, but it's just like the number of patients I've had already in like 8 months that like their doctors have just told them to like only rest or like not do this or not do that. And it's just made it worse.
well,
I know, it's wait till you get the doctors that say that and say, I really recommend that they you do ultrasound inferential with the client. There's still a lot of doctors out there that don't understand modern day physiotherapy.
Like I'm 23 and I have a better idea. Like, come on, it's so frustrating. But anyways, that's a personal gripe.
I was just going to say, I think like most people like being involved in their own health decisions, like particularly when it comes to their body. So like if you can involve them in like any way you can, I feel like they'll respond better, which like we've said in the past. But yeah, I'm confused by the last for behavioural change, throwing spaghetti at a brick.
Oh yeah, we'll get to that. That's all good.
Okay.
I think I just didn't want to put that on a slide by itself because it's like not that important. Did anyone have anything else to say about these approaches?
Oh,
Yeah, so for behavioral change, information alone is like throwing spaghetti at a brick. So I think this ties in an interesting way to what we were talking about last week about education and communication makes all the other skills in your toolkit that much better. But I think you can't just be a textbook and like word vomit information to our clients. Like that's not going to do anything. You need to make it relatable and specific to that patient, I think. So for me, it might be, okay, like it'd be really good if you could do these exercises a couple times a day. Let's talk about how we can make that fit into your routine to make it actually like sustainable and something that you can actually do, rather than just saying like, do this, you'll be fine, like sort it out, whatever. Or, you know, I had a really good example and forgot it. Does anyone have anything to say whilst I think of my example again?
I think you just, to change someone's behavior like that, you can't just tell them what to do. You've got to involve them in the situation. You can't just tell them information and then, you got to do those soft permissions and let them think of it themselves or come up with it themselves in their head. Let the light bulb go off in their head first, and then they can take action.
Yeah, it's almost like you can't just throw them in the deep end, like here's all this stuff, like off you go.
Yeah.
If it's going to actually work, you need to work with them and not show them how to do it, but like really integrate that whole process. So Rose, do you have anything else to add?
no, I just wanted to finish by saying, yeah, just involving them in the process is so important, but you can still lead them where they need to go. And I think that's good too.
Rose, does that clarify that statement for you all? Or do you have any more questions?
Yeah, no. I just didn't know that
It's
spaghetti
weird
at a brick
context.
thing. Like you could have said anything. I just have never heard that before. Or like,
yeah,
no, it
neither would
makes
I,
sense.
don't worry. Yeah,
No,
it's
it
more
works.
just like it's not going to do anything.
Yeah. I was like, am I missing something? Yeah.
No, that's all good. That was it. This was just a quick one today. Sorry guys, and not as well, in my opinion, a bit more dull than last week, but
No, it's
good
great.
to, I guess, just build on the things that we discussed last week. Does anyone have any other comments or questions?
No, I've really enjoyed those two, and I've got some great take-home messages for application.